Good afternoon and welcome. I'm Sophie Crawford Ross. I'm the chief nurse here at Bon Secours Community Hospital, and it's exciting to have you here as we announce this wonderful news for Bon Secours Community Hospital in the Port Jervis area. It's my pleasure to introduce Dr. Mary Leahy, the CEO of Bon Secours Charity.
Good afternoon, everyone. It is with great pleasure that I stand here today and announce our $45 million enhancement of Bon Secours Community Hospital that we expect to transform healthcare delivery here in Port Jervis and in the nearby areas, extending into parts of New York, New Jersey, and Pennsylvania. This innovative project would not have been possible without our relationship with Westchester Medical Center Health Network and their leadership and forward-thinking vision of Michael Israel. As many of you know, just over a year ago, we signed a partnership agreement to become a member of the WMC Health Network, and we already see its impact today on the care we were able to provide to our community. Together, we are helping to transform communities and make them stronger, more vital, and economically sound. This joint venture represents an unparalleled opportunity to enhance the quality of services for the people in the region and will preserve and expand local health care. We share with WMC Health the mission to ensure that our friends and neighbors have access to the finest health care available close to home without having to leave the region. Working with community leaders and healthcare providers, we are changing the way the community receives its healthcare and improvements at the access as well. I want to acknowledge our valuable partners, Cornerstone Care and Orange County Department of Mental Health Services, who are here with us today. Thanks to our relationship with them, we will be able to offer dental, women's health, pediatrics, behavioral health, and many other primary care and preventative care services. This is all part of the Medical Village concept, where much needed care, options, and healthy lifestyle information will be accessible to area residents in a convenient location. At the Wellness Center, we will offer preventative monitoring services, and we will be able to have community outreach for many diseases that we find, particularly in this area. Let me take a few moments now to highlight the elements of the renovation plan. It will include an expanded emergency department with more than 10,000 square feet of space and a separate behavioral health entrance. It will also include an upgraded imaging suite, conversion of 36 semi-private rooms in the medical and surgical suite into private rooms, a newly designed bariatric center, and a new retail pharmacy. In closing, I want to say how excited I am for the future, and I promise that at Bon Secours Community Hospital, you'll continue to find compassionate, quality inpatient and outpatient care right in your own backyard. This is the greatest gift that we can give to our community. Thank you. And at this time, I'd like to introduce Michael Israel, the CEO of WMC Health, who will share a few words.
Thanks, Mary. And I'd like to thank all the guests who've come here today from the Port Jervis community. I've got to tell you that we being WMC Health, we're incredibly excited to announce the investment in this organization that we believe will be transformative, not only from a healthcare perspective, but for the greater Port Jervis area in general. May 19th of 2015. Thank you. About 18 months ago, we, as one of the board members said, we had a board meeting this morning, we merged with the Bon Secours Charity Health System, and Bon Secours Charity Health System and the 3 hospitals became part of WMC Health. And at the time, considering that there were many suitors for this organization, for Bon Secours Charity Health System, I said publicly that I felt like I had gotten the date for the prom that I always wanted. We believed that we could do more than the others who were looking at this institution, because what we thought about was making a commitment to the people of this region, and not only looking at this hospital and the other two hospitals in the Bon Secours charity system, but we believe that we could not only have a profound effect on the health care that was delivered, but we believe that we could have a profound effect on the community in general, in terms of investment in this organization and investment in the community. And when we invest in this organization, what happens? There will be more jobs created. We will use more goods and services, so we will be an economic driver. And we'll make this community and the surrounding community stronger, more vital, and economically sound. Now, over the past 18 months, we've been working very closely with Dr. Leahy, with the administrative staff here, with the corporate folks at WMC Health, with the corporate board, with the board of charity, and a number of strategic partners that we have. An example of one is Philips Medical, to put together this plan, which you will see in detail, so that we can act on that vision. So in closing, what I'd like to say is that with the resources of WMC Health, combined with the successful grant award from the state of New York, and I'd like to thank those individuals here today who were responsible for that, we're going to share with you the vision for the $40 million plus, as Mary said, investment, not only in this organization, but in our community and its people. So thank you very, very much for your support, and I think what you will find is that your support was well-founded. Thank you.